Hi everyone, Dr. Jamie Seabrook here, and I'm going to give a brief presentation on maternal diet and the offspring gut. And I'm going to do that by highlighting and referencing two recent papers, particularly on this topic. The first paper that I'm going to address is a mini review that was published in 2021 called The Role of Maternal Diet on Offspring Gut Microbiota Development, a Review. And I have the full reference there as well in case you want to go to that particular paper. So I'll talk about the introduction first. The authors highlight the importance of folic acid, which we all know is very important during pregnancy. So they note that maternal supplementation of folic acid is recommended for all women during their childbearing years to help facilitate the closure of the neural tube and reduce the incidence of neural tube defects in future pregnancies. And they highlight some references in the introduction, including a Dutch population study published in 2016, where insufficient maternal folate levels negatively impacted the postnatal brain development of children ages 6 to 8 years of age. And they also highlight another study published in 2012 from the Netherlands that found that 3-year-old kids whose mothers had low levels of folate during pregnancy were at a higher risk of various emotional problems. They also note that experimental evidence, and we know from research that experimental evidence is considered the highest level of evidence, like a level 1 evidence, and that shows that maternal supplementation of dietary folic acid is critical for offspring neurodevelopment. There's also a documented link between folate and the gut microbiota. So in terms of the introduction of the gut-brain axis communication, it remains unclear whether maternal diet during pregnancy has an impact on offspring microbiota, although we do know that maternal diet leads to pronounced epigenetic and phenotypic effects which can influence the developmental origins of health and disease, most commonly called abbreviated DOHAD. So this aim of this particular mini review was really to get at whether maternal diet impacts microbiota development in offspring. And for those that don't know what a mini review is, it's basically a way to summarize a lot of the key concepts on a given topic and then describe both a lot of the current and as well as the most relevant findings on that particular area. So in terms of their methods, they used both animal and human studies to help get at the impact of maternal diet on offspring microbiota development and potential consequences thereafter on neurodevelopment. And this is a direct quote. They said a total of 12 clinical randomized cohort or longitudinal studies were reviewed. So basically studies RCT, of course, would be the highest level of evidence in a level 1, and the other ones would be ones that go forward in time. That's the cohort or longitudinal studies. In terms of results, they looked at maternal obesity and offspring gut microbiota development, and they found that several studies found differences in the gut microbiota between infants from overweight pregnant women and those that were of normal weight. So if you kind of take a look at this figure here, it's basically showing how the overweight status can subsequently influence the infant and even into potentially adulthood when we look at things like metabolic outcome. In terms of the results associated with the combined role of maternal diet and mode of delivery on infant microbiota development, this is some fascinating areas of research. So they found that the effects of maternal prenatal dietary factors on the infant gut microbiome can vary quite a bit by mode of delivery. That is, whether we're talking about a vaginal birth or a cesarean birth. So they point out one paper from 2016. It's a cohort study that showed that formula feeding during the first 2 years was associated with microbial disturbances. They also note that in animal studies that they were able to assess, high maternal dietary fat was shown to impact offspring microbiota development and neurological health, thus increasing the evidence in that area as well. So their main conclusions, there was a few. The key take-home point was that maternal diet does in fact play a key role in offspring neurodevelopment and helping to prepare the brain for early life programming. And the review basically found more specifically that maternal diet during pregnancy does influence early postnatal microbiota development, and perhaps this could serve as a way, a method, a mechanism through which maternal diet actually influences neurodevelopment. The gut microbiota is also influenced in brain health throughout the life course, starting as early as postnatal neurodevelopment and all the way into old age. And last but not least, if the gut microbiota is not composed of adequate levels of specific bacteria, this could negatively impact the brain development of the offspring. So the second paper that I want to discuss came from the journal Nutrients, and it was called The Impact of Maternal Nutritional Supplementation During Pregnancy and Lactation on the Infant Gut or Breast Milk Microbiota, a Systematic Review. Keep in mind, everyone, that a systematic review is kind of like the epitome of research, right? So we have like descriptive studies near the bottom, cross-sectional studies, and then we kind of move up the ladder into case control studies and move up a little bit farther into cohort studies, going prospectively, longitudinally over time, moving forward. And then we get into, randomized control trials and systematic reviews and meta-analyses. Keep in mind that a systematic review, although it will capture all studies on a given topic and a particular research question, is only as good as the papers that are able to come in, okay? So in terms of the introduction for this systematic review, the authors note that there's a growing body of literature showing that the gut microbiota plays, in fact, an essential role in both health and disease. However, the role of maternal diet specifically throughout pregnancy on the development of the infant gut microbiota remains unclear in terms of the in utero effects. They also note that reductions in gut microbiota diversity or species richness have been reported among babies specifically who are formula fed and have been correlated with a variety of health outcomes such as irritable bowel syndrome, obesity in adulthood, or even diabetes. And it is not clear, however, whether maternal diet or maternal nutritional supplementation can in fact impact or alter the infant gut microbiota, and whether breastfeeding helps to modulate these potential impacts. So the objective of this study was to conduct a systematic review to determine whether the effects differ by the type of nutritional supplement and infant feeding practice, and whether changes in the infant gut or breast milk microbiota were associated with a variety of improved health outcomes. In terms of their methods, the study was performed based on PRISMA. That is kind of the go-to in systematic reviews. PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analyses, and they had registered their protocol with Prospero. Just a quick note that more and more systematic reviews, whenever possible, it is highly recommended that you register that systematic review before you begin, because That way you're being transparent about what you're setting out to do. And then when you write up your manuscript, people can refer back to that initial registration and your objectives and what you were proposing, your statistical analyses, etc., and to see, in fact, if your protocol lines up with what you did in terms of outcomes, exposure, and so forth. So in terms of their inclusion and exclusion criteria, they used randomized control trials, what's referred to as quasi-randomized control trials, as well as cohort studies. All of these were included in their review. For those who don't know what a quasi-RCT is, it's when participants allocated to different arms, one treatment or the other, or treatment control, are allocated in a very non-typically random, that is a quasi-random way, where allocation is not adequately concealed. So the true random 50-50 chance of going to group A or group B is lost. And of course, the challenge with that, although a quasi-RCT is still a high level of evidence, is that when you don't have the true random allocation, then you don't know for sure if you have a covariate balance or imbalance between the two groups, such that perhaps one group has a, I don't know, higher baseline health status, or has a different age than the other group, or a different prognosis. So these things can have an influence potentially and bias your outcomes. Conference abstracts and unpublished reports were included if they provided sufficient information about the study design, characteristics of the participants, and the results. I'll just say, whenever possible, it is ideal if you can include in a systematic review gray literature, and conference abstracts and unpublished reports are considered gray literature. And the reason why that's important is because gray literature is more likely to have null findings, because we know it's called publication bias, that editors and journals have a bent towards publishing results that are statistically significant, that reject the null hypothesis. So with that, if we include gray literature, we're more likely to have results that don't find significant findings, which is important. Granted, however, that some gray literature has not gone through the same methodological and peer review as one would have from a published research article. So we kind of weigh it all. Only studies published in English language were included. Whenever possible, it's better to include other languages. However, there has been some recent research showing that the impact of only including English language doesn't seem to be as impactful as one might have anticipated before in the past. And studies of poor quality of evidence were excluded. This is more typical in systematic reviews when we have a large enough sample of studies that have met the inclusion criteria that we can go, hey, let's give more weight to studies that are moderate to high or very high quality, and those that are poor, we either give a lower weighting or we exclude them altogether. This is a bit more difficult to do when we have very few studies that meet our inclusion criteria. And participants were women who were at least 18 years of age and who were subsequently randomized to receive nutritional supplements during pregnancy and/or lactation. And all participants must have provided breast milk samples and/or stool samples from their infants. And included studies had a comparator group of women who either did not consume a supplement during pregnancy or lactation, or who received some type of a placebo effect. In terms of the risk of bias and the quality information assessment, the authors used the Cochrane's collaboration tool to assess the risk of bias, where bias was graded as low, high, or unclear if that couldn't be determined. And they used the grade approach, which is very typical, which determined the overall quality of each study, such that each study was graded on a scale from high to moderate to low, or potentially a very low quality of evidence. And GRADE incorporates, and for those who are not familiar with GRADE, you can see a little bit more over here in this table, incorporates study design, risk of bias, indirectness of evidence and inconsistency, or some imprecision of results due to determine the study quality. In terms of their statistical analysis, a meta-analysis could not be performed on the primary outcomes. That is the case, everyone, when you have substantial heterogeneity existing between studies. That could be because of differences in outcomes and how they were measured, differences in exposures and how they were measured. It could be due to differences in dose-response type effects. All of these things create essentially noise and variability that makes pooling data somewhat useless, and it can really have a detriment to the overall effect size. So when you have so much heterogeneity existing between studies, it's better not to do a meta-analysis and simply to narratively report on the data via a systematic review without pooling the data per se via a meta-analysis. Nonetheless, due to homogeneity across studies, they were able to do one subgroup meta-analysis with an N of 7 studies. And this was performed on whether maternal probiotic supplementation during pregnancy and lactation resulted in the colonization of the breast milk microbiota. And they did their meta-analysis using RevMan5. I've used that in meta-analyses as well, myself and my graduate students. It works very good. And essentially what it does is when you have in this case, a categorical outcome variable, it will produce an odds ratio with a corresponding 95% confidence interval for each study. And then when it has each study, it will then pool that data and combine it to get an overall odds ratio estimate for the pooled results. And they used, in this case, a random effects model as opposed to a fixed effects model. I won't get too much into the differences in that right now. And in terms of their findings, 29 studies were included in their systematic review, all of which were randomized control trials published somewhere between 2005 and 2020. 27 of the 29 studies were from high-income countries. The one thing I found a little confusing was that they noted, this is a direct quote, that ethical approval was sought in 27 of the studies, and 4 studies failed to mention ethics. It's a little unclear to me because 27 and 4 is 31, and only 29 studies were included. So I'm not sure there's something I'm missing there, or if there was an error in their reporting, or something was missed, but those numbers don't really add up to me. 23 out of 29 studies administered probiotic supplementation to the intervention arm. 6 of the 29 studies investigated vitamin D, prebiotics, or lipid-based nutritional supplements. And all 29 studies were assessed using the GRADE approach. You can't read that there because I'm in the way, but and this grade, again, ranked the studies as high, medium, low, or very low study quality. Here is right from their paper, here is a breakdown of what they have found in terms of their final included studies in their studies. So they began their database search with identifying 965 papers. They found 2 additional through other sources, removed all the duplicates. You can find your way down. But ultimately, 29 studies were included in their narrative, that is their qualitative systematic review. And 7 studies, as I mentioned before, were able to be included in their meta-analysis because there was a homogeneity. In terms of the infant gut microbiota, all 5 out of 5 studies found significant results between maternal probiotic supplementation administered during both pregnancy and lactation on the probiotic colonization of the infant gut. And then when we looked at the breast milk microbiota, 7 studies investigated whether probiotic supplementation during pregnancy and lactation resulted in probiotic colonization of the breast milk. Of those 7 studies, 6 of them did in fact find a detection of the probiotic in the breast milk of supplemented women. So I took this bullet right from the figure to your left. So the meta-analysis found that maternal probiotic supplementation results in colonization of the breast milk microbiota. So the odds ratio there is 5.9, and the 95% confidence interval gives us an estimate of how good our estimate is of that odds ratio. So we'll see that 5.9 falls in the middle. In other words, the true odds ratio between maternal microbiotic supplementation and the colonization of breast milk microbiota would fall somewhere between an odds ratio of about 2.3 and about 15.2, so quite widespread there. And if you look at the figure to your left, what you see is a list of the 7 studies, each of which have a corresponding odds ratio and confidence interval. And then you'll notice that in the plot to the right, what it does is the final confidence interval and odds ratio takes all of those studies and pools it to ultimately get that odds ratio, that pooled odds ratio of overall of 5.93, with an I-square statistic of 31%. Which does not indicate a major problem with respect to heterogeneity. There's some differences in the literature, but basically as we get into an I-square of like 50% becomes a bit of a problem. The heterogeneity, certainly anything greater than 75%, is very, very high. With respect to vitamin D, the results showed that 2 randomized control trials assessed the impact of vitamin D supplementation during pregnancy on the infant gut microbiota, and both of them found no significant differences between either the placebo group or the vitamin D supplementation group with respect to the infant gut microbiota. And lastly, in terms of their discussion, the systematic review suggests that maternal supplementation during pregnancy and lactation can influence the infant gut microbiota or breast milk microbiota. And importantly, this was the first systematic review that actually assessed this correlation. And on a positive note, the vast majority of the studies that were included in their systematic review were of high quality of evidence. The big limitation, of course, was the heterogeneity existing between the studies, which limited their ability to perform a meta-analysis on the key outcome variables, the primary outcomes. Of course, it's not their fault. They don't know what the heterogeneity will be pre-study before they begin the systematic review, so it is what it is. They did a good job at pooling all the studies and narratively, qualitatively describing the studies and synthesizing them. And the authors advocate, and rightfully so, for more high quality randomized control trials in future research. So that basically sums up the overall theme of my talk and the 2 papers that I wanted to highlight here. Hope you enjoyed that. If you have any questions, do let me know. Have a great one.